My name is Bree. I am doing my return demonstration for tracheostomy, suctioning, and tracheostomy care. In front of me, I have my patient with trach. I have my suction kit, and I have my um, cleaning kit. At this time, I would knock on the door. I'm going to introduce myself. Hi, my name is Bree. I'm going to be your nurse today. I'm going to use two patient identifiers to verify the patient. I'm going to verify orders that the doctor has prescribed. I'm then going to provide privacy. And then I'm going to explain to the patient what we're doing, answer any questions that they may have. I'm also going to get a verbal consent and ask what their goals may be. I'm going to raise the bed to a working level, put the patient in a semi-Fowler's position, and then I'm going to perform hand hygiene. I'm going to don clean gloves. I'm going to turn on my suction. If I was in an actual facility, I would turn on my suction to 80 to 150 mmHg per adult. I'm going to then increase the oxygen to the hyperoxygenation protocol per facility. I'm going to place a pulse oximeter on the patient, and then I'm going to remove my gloves, perform hand hygiene. I'm going to lower the side rail that I'll be on to make it more convenient. If I had the PPE, I would apply a mask and goggles to protect myself from any secretions that may come out. I'm then going to scoot this over. I'm going to open my sterile kit. I'm going to don my sterile gloves, maintaining a sterile field, of course. Identifiable break number 1. I'm going to actually open the normal saline, laying the top on the side of the bedside table. Then I'm going to don sterile gloves, maintaining sterility. I'm going to remove the sterile basin from the pack. I'm going to maintain a sterile field. I'm going to pour, if I had normal saline, I would pour it from 4 to 6 inches above into the thing, and then I'll have a non-dominant hand that's going to reseal the normal saline that I had that was sterile. I'm going to pick up my suction catheter. I'm going to keep it sterile. I'm going to dip it into the normal saline to moisten it. At this time, I would remove the tracheostomy mask that is on. With my sterile hand, I'm going to insert the tracheostomy trach. I'm going to insert the trach into until I meet resistance from the patient. And then I would withdraw a half an inch and turn on the suction for 10 to 15 seconds. When removing, I'm going to make sure I'm checking for coca, which is color, odor, consistency, and amount. I'm going to assess the patient's breathing, skin, and check the pulse oximeter to make sure they're good. I'm going to make sure that I'm observing for any skin color changes or respiratory distress. I'm going to rinse the catheter in the sterile saline. I'm going to make sure that I state to the patient there's going to be a 60-second break in between. I'm then going to repeat those steps. I'm going to insert the suction until I meet resistance, pull back at least a half an inch. I'm going to suction the patient. making sure that pass is within 10 to 15 seconds each. I'm going to assess for COCA, which is color, consistency, odor, and amount. I am then going to assess for the patient's breathing, skin color, and the pulse oximeter. I'm going to make sure there's no skin color changes or any skin color changes or respiratory distress. I am then going to disconnect the catheter tubing from the patient. I'm discarding of all the supplies. I am then going to make sure the suction is turned off. I'm going to make sure the patient is comfortable in a good position, return the mask to the tracheostomy. I'm going to put the side rail back up. I'm then going to put the collar in position, make sure the wheels are locked, ask if they need any help, and then I am going to come back and do tracheostomy care. I have to save my gloves. My sterile gloves, these are sterile for my trach cleaning care. I'm sorry, we didn't get much materials for this. Coming back in, I'm going to, of course, identify myself. I'm going to knock on the door. I'm going to provide privacy, verify orders for tracheostomy care. I'm going to use 2 patient identifiers. I'm going to explain to the patient what we are going to do. I'm then going to put on clean gloves to remove the dressing that I do have on the patient currently. Removing this dressing. Checking for COCA, which is color, odor, consistency, and amount. I'm going to discard of this stoma. I'm going to remove the gloves that I do have on. I'm going to perform hand hygiene. I'm going to open the inner cannula on one side, making sure one side is always tied. Oh, I'm going to open self-identifiable break number 1 for tracheostomy here. If I had an inner cannula, I would be opening the inner cannula. I do not have one. So if I had one, it is opening the inner cannula on the bedside table. I'm going to open my tracheostomy kit. I'm going to, of course, if I had normal saline that is sterile, I would open the top, I would pour it in, and I'm going to don my sterile gloves using the sterile technique. I'm going to place these on a sterile field. I'm going to pre-moisten my gauze in the tips of my Q-tips. I'm going to, I'm sorry, I'm sick. Pre-moisten the tips of these applicators. I'm going to I'm going to gently insert to clean. I'm going to gently insert at a curvature following the direction of the curvature of the tracheostomy. And I'm going to use the moistened Q-tips to clean from the right side to the left side of the tracheostomy. And then I'm going to make sure that it is secured with its device. Of course, I have ties right here that are secured, making the patient so that it's tight and not flinging around. I'm then going to stabilize the non-dominant hand. I'm going to use the Q-tip to place this. Sorry, it's not very easy with this technique. Place this in position. I'm going to replace the tracheostomy mask. I'm going to discard of all my materials. I'm going to make sure the patient is comfortable. I'm going to ask if they have any questions. I'm going to put the side rail back up. I'm going to self-identifiable break number 2, I did replace the inner cannula into the curvature of the patient's tracheostomy. Because I don't have that, I did forget, but I did notice my self-identifiable break. I'm then going to put the side rail back up. I'm going to perform hand hygiene. I'm going to remove the pulse ox that we had on the patient during this process, because we're obviously making sure, because we're messing with respiratory, that we're taking time to keep track of make sure they're not in any respiratory distress. I'm going to clean or disinfect any equipment that I may have been using. I'm going to raise the side rail, lock the wheels, put the call light in position, perform hand hygiene, and then I'm going to leave.